I had a patient come in earlier this week that had a car accident 4 years ago, had a whiplash injury. She damaged this ligament here on the front of her neck called the anterior longitudinal ligament and some of the tendons on the back part of her neck as well. It was very unstable. The problem is that she was sitting at a light and she was hit from behind. It caused her head to swing backwards. And then violently her head swung forwards and it created damage to the ligaments all around the back part of the neck as well. You can see all the vertebrae in there. There's the ligaments in the front, the muscles in the front, and the muscles in the back. But what also got damaged was the nerve. And anywhere that nerve goes, in this case it was the nerve that went all the way down her arm, right down into her hand, that created the biggest problem. So for her, what she found was this. And I'm going to open up this editor so I can point out some areas. So she had damage to this ligament here, called the anterior longitudinal ligament, and this ligament here, called the nuchal ligament. Now, muscles which attach from bone to bone, or bone to ligament sometimes, as in the case of the nuchal ligament, but usually it's bone to bone, create movement at the joints. So these red things would be considered all the muscles between the bones. The ligaments, right? The ligaments are areas, and I'll draw it in white here, that attach bone to bone. And in this case, they limit the movement of the joints. And I'm just going to erase those since I drew all over my drawing. So ligaments create stability by limiting joint motion. Muscles create movement by moving those joints. In this case, what she had injured was both of the main ligaments, which created stability. The problem with that is this: as soon as the neck becomes unstable, you could have everything you want. You could do, all kinds of adjustments. You could do all kinds of acupuncture. You could do all kinds of massage. You could do all kinds of different therapies. If there's damage to the ligaments, if you think about it, if you sprained your ankle, the only way to restore stability to that area is to create support for those ligaments and to create some type of rehabilitation for the muscles that are involved in supporting that area. So for her, the problem is between the bones, well, this is for everybody, is where the nerve comes out. So these yellow things are the nerves, and they come out from between the bones. And those nerves go right down to the different areas. So the nerves that come out the neck, they go around, a little bit around the face, so the neck, they do the arms, the shoulders, the hands, and right down into the fingers. So for her, there was a problem with this nerve right here, and it created a significant challenge with pain, disability, and it's called a radiculopathy. But really, it's a pain and disability down into wherever that nerve goes, and in this case, it went right down to her hand. She's had all kinds of hand therapy. They've assessed her for carpal tunnel syndrome, etc. And what they didn't do was take an x-ray that looked at the alignment of the neck. So I'm going to erase some of this. And what they did was they looked at to see if there was anything broken, and there wasn't. They looked to see if any of the ligaments were completely torn or ripped, and they weren't. But what they didn't do was a functional assessment to see whether or not those ligaments were doing their job with movement. So I took an x-ray of her with her neck bending forwards and found that this area here was not being supported at all. It was hypermobile, meaning it was moving too much. So the problem was that she had an abnormal movement pattern in the lower part of the neck, in this area here. So what we needed to do, so it wasn't broken, it wasn't torn, but it was an abnormal movement pattern. So what we needed to do was, number one, we wanted to restore the normal curve in the neck for her, but we needed to get pressure off the nerves. She had a subluxation in this one here called C1. C1's called the atlas, and if it's not right, nothing in your body could be right. Think of Christopher Reeves. He had a problem, the guy who played Superman in the movies. He had a problem right at the top of his neck, and it affected everything. Once we get this area at the top of the neck cleared out and functioning properly and the pressure off the nerves, what we'll be able to do, I'll take some of this stuff off here. What we'll be able to do is create a normal curve in the neck, create normal stability in this ligament, and once we do that over the long term, these discs in here won't go through the degenerative process, because what will happen incredibly quickly is as soon as it becomes unstable, it degenerates. So you may have heard of degenerative disc disease. Degenerative disc disease means an area has become unstable over an extended period of time. So my goal with this patient is number one, I just want to get her out of pain so that she can go on with her day-to-day life. Number two, I want to restore normal nerve activity because the nerves control all function, healing, and recreation of new cells. And then number three, I want to provide stability over the long term so that, I know that's terrible doctor writing, so that not only can it remain stable, but it'll stop this degenerative process and keep the body from breaking down prematurely. So if you've been in a car accident, if you've had an MVA, if you've had a whiplash, have somebody do a movement pattern assessment on you. Have them take x-rays of you in a moving position, either looking down at the ground or up at the ceiling to assess the movement of those vertebrae, and have them do it in a standing gravitational position. Because a lot of times people will get like an MRI, and an MRI is great because it can look at all these soft tissues, but it's done with you laying down. It doesn't tell us what your neck is doing when you're moving. You can get a CT scan, same thing. Even if you had an x-ray, but the x-ray is of you just looking straight ahead, that doesn't give you all the information that a flexion extension view would, and you do a series of chiropractic measurements on them to see how well these bones line up compared to how well they're supposed to. If you haven't had one of those tests, have that test done. Have them look to restore stability to it, not just get you out of pain, but how are we going to restore stability to it so in the long term you can be healthier. All right, I hope you found that useful. I'm Dr. Ryan from Inside Out Family Chiropractic. Have a great day.